My name is Joshua Boyce. I'm the Chief of the Division of Allergy and Clinical Immunology at the Brigham and Women's Hospital, and I'm a professor of medicine and pediatrics at the Harvard Medical School. Our division has three closely interrelated missions, the first of which is to provide state-of-the-art, compassionate care for patients with all manner of allergic and immunologic disorders, both rare and common, across the age spectrum. The second is to use cutting-edge research strategies to develop novel treatments and diagnostics for patients with allergic and immunologic diseases by understanding on a deeper level the mechanisms and causes of these diseases. And the third is to train the next generation of leaders in the discipline of allergy and clinical immunology in the academic setting. Collectively, allergic diseases and immunologic disorders represent the largest group of human ailments, affecting perhaps as many as 40% of the population. These diseases start manifesting themselves in infancy, where atopic dermatitis and food allergy most commonly present. Asthma typically begins in early school age, and in teenage and adult years, we begin to see increasing numbers of patients who present with complaints of seasonal rhinitis, chronic rhinosinusitis, and chronic urticaria. Drug allergy and immune deficiencies can develop anywhere along the age spectrum. And less common disorders, such as hypereosinophilic syndromes, mastocytosis, and hereditary angioedema, also find their home in the hands of allergists and immunologists. In our division, we have the largest academic clinical practice in the northeastern United States that draws patients from all over the world to see our experts in virtually all of these diseases. Our clinicians are qualified to see both pediatric and adult patients, and thus can provide care to multi-generational families with allergic and immunologic disorders. Our research program is one of the largest and most successful in the specialty. Our studies range from the most basic and fundamental aspects of the human immune system using molecular technologies to epidemiologic studies to cutting-edge clinical trials with novel biologic therapies for the treatment of our most severely allergic patients. Our training program is really the crown jewel of our division. It is a National Institutes of Health funded program that has been in existence for over 50 years and has trained many of the leaders in the discipline across the world. And in the last 10 years, we've had a remarkable run of success with some of the most talented individuals I have had the pleasure of mentoring, many of whom have remained within the division to start their own independently funded research programs, and some of whom have gone on to have highly successful programs at other prestigious institutions. This is a very exciting time in the history of our specialty. The advent of novel biologic therapies to treat the most severely affected of our asthma patients, our patients with chronic sinus disease, and our patients with atopic dermatitis affords us the opportunity in the clinic to provide game-changing therapeutic strategies for these patients. At the same time, the evolution of the tools and technology that we have to study the human immune system on a very deep level using very, very small amounts of biological tissue gives us the opportunity to make further discoveries that will result in the next generation of novel treatments and furthering and improving the quality of life for our patients.